right, so let's get started. Our goals today are to talk about what is the definition of cancer-related fatigue, identify the common symptoms, identify ways to reduce that cancer-related fatigue, and programs and resources that are available within the Helen Graham Cancer Center as well as within the community. So the definition is cancer-related fatigue is a distressing, persistent, subjective sense of physical, emotional, and or cognitive tiredness or exhaustion related to cancer or its treatments that's not proportional to recent activity and interferes with usual functioning. So just walking to the bathroom or getting up and getting dressed and being exhausted, that is not in proportion with what is normal for fatigue. Compared with people who have not experienced cancer, it's cancer-related fatigue is more severe and more distressing and less likely to be relieved by rest. So a lot of times people will say to me, no matter how much I rest or sleep, I don't feel any better. And that's a big factor that we need to educate people on, because I tell my patients staying in bed is not going to make it better. And I often encourage my patients that no matter whatever stage you're at, you are a survivor. You are surviving cancer. And unless you're vomiting or, really, really sick, you need to try to be out of bed and dressed, because it really changes the whole mental mindset that goes with it. 80% of patients receiving chemotherapy or radiation have cancer-related fatigue. Go ahead, switch to the next slide. Sorry. 75% of patients have fatigue if they have metastatic cancer. 29% of survivors that are in total remission, not in treatment, still have cancer-related fatigue. 40% of people at diagnosis have fatigue, and 80 to 90% have it during treatment. So that is a huge portion of the population experiencing cancer. So it's a really important thing to talk about and to educate people about. It is the most common side effect associated with cancer. So we'll talk about some of the signs and symptoms: feeling tired, weary, exhausted, lack of energy, weakness and heaviness in the arms or legs, like my legs feel like they're 10,000 pounds, and there's no logical reason for that. Irritability can even be a symptom of that fatigue. And as caregivers, we need to recognize those kinds of things as well. Trouble starting or finishing tasks because it's just too tired or overwhelming. Needing help with normal activities, being too tired to eat. That's a big factor for me with my patients. We often talk about that because food is fuel. And sometimes we got to prioritize what we're eating if we don't want to eat. Difficulty with concentrating or memory. It kind of goes hand in hand with that chemo brain. And limiting your social activities due to tiredness. That is another thing I really encourage my patients to do, is to prioritize those social interactions. If it means you don't do the chores that somebody else can do because you can go out to lunch with your girlfriends or go to church or whatever, that is an appropriate choice to make, because it's going to make you feel so much better. The next slide. Why am I so tired? There's so many reasons that can contribute to that fatigue. So many people during treatment have anemia. Their muscles have gotten weaker because they don't feel well, so they're not getting up and moving around. The chemo itself affects our muscles. There's all the side effects of all of those chemicals that they're pumping into us, along with the medicines that are giving us to treat the side effects of the treatment. Pain is exhausting. So if you're having pain, that's going to cause even more pain. Other medical conditions, whether it's diabetes or hypertension or COPD, those things can also be flared up, making that fatigue even worse. Nutritional deficits. you're not eating enough because you don't feel good, or maybe you're not eating the right things. So sometimes we have to talk about bringing in nutritional support, meeting with our nutritionists that are at the cancer center that specifically only work with cancer patients. Emotional distress, I mean, that's exhausting. Um, Sleep disturbance. How many times do people tell me the steroids have them so revved up? You know, with breathing problems, I take high dose steroids at times, and it's like being the Energizer Bunny, but you're exhausted, but your mind's going 10,000 miles an hour. Or pain disturbing sleep. So there's so many factors that are contributing to it. We'll move to the next slide. Conditions outside of your cancer, infections, those abnormal blood values, you guys can read all of those. But hormone levels, when we're dealing with especially breast cancer, the hormone suppression drugs really have an impact on fatigue. And that's something that we really have to acknowledge with patients, and they need to understand that the medicine could be causing this symptom, but it's a necessary medicine for your cancer journey. But how can we counteract it? Any other issues that you already have? Thinking about if we're taking sleep aids, that lingers over, that hangover effect. The pain medications and the nausea medications add to that fatigue. So when do we take them and when do we not take them? It's a real challenge. And then we'll talk a little bit about, I don't know how many of you are aware of the National Comprehensive Cancer Network. They are the ones that give us the guidelines for cancer treatment. And they have amazing resources for patients as well. They really talk about treatment options in layman's terms and understanding fatigue, understanding management in young adults, in older adults. There's a lot of resources available through them. I would encourage people to take a look at that if they want more knowledge. But the non-medical interventions that they recommend in their protocols and recommendations, physical activity is the number one. Physically based therapies such as massage, psychosocial interventions we'll talk about, and cognitive behavioral therapy, especially for sleep. We'll talk about each of these a little bit. So of course, my area of expertise is physical activity. So maintaining optimal levels of activity. We want our patients to consider an exercise program. The research tells us that the most effective treatment for cancer-related fatigue is actually exercise. There's lots of research related to it. There's some handouts that they will send out to you guys. It's a nice handout that talks about the different side effects of cancer and its treatment, such as anxiety, cancer-related fatigue, neuropathy, and what the research says the best type of exercise is. So that will come out to you guys via email. The exercise programs could be endurance, whether it's walking. It should include some type of stretching. Most patients, I try to incorporate some kind of balance activity. There's a ton of research on yoga and how beneficial that is, which is probably one of the reasons why it's provided here. There's actually several times in my treatments that I refer to the cancer support community because they have these programs and they are at a place that they can afford to participate in them, because in the community they're so expensive. And when is it time to refer to occupational therapy or physical therapy? We'll talk about that a little bit. So what are the benefits? We all pretty much know the benefits, but we're going to be stronger with our hearts. We're going to make our muscles stronger. We're going to improve our balance. Sometimes we lose weight. It helps fatigue. It helps our mental state. There's actually chemicals that are released, the same kinds of chemicals that are released with laughing, sex, pain medications, like those chemicals are very similar with exercise. And overall, just an improved quality of life. So this is where I talked about that Academy, American College of Sports Medicine. I always mess up what it stands for, but nobody really cares because they're not looking it up. The guidelines for cancer survivors. And I use these even with my patients that are in treatment and say, maybe you're not achieving that same 150, but that's what your goal and you're working towards. If you're in active treatment, we have to modify things. But 150 minutes of moderate intensity exercise or 75 minutes of high intensity. I don't have very many patients in my experience that are doing high intensity. And if you didn't do it before your cancer diagnosis, I really don't recommend you do it after. Moderate, I usually say, if you can talk while you're doing it, but you can't sing, that's a moderate intensity activity. So if you're walking down the street and you can sing the Star Spangled Banner, you're not walking fast enough. Okay. But if you can have a conversation and occasionally, like when you get to those hills, you're a little short of breath, or you feel that little change in your voice, that's where you need to be. Strength training is a major important component of any exercise program. We usually recommend 2 to 3 times a week, unless you're in therapy. And then I say it's 6 days a week. Even God rested on the 7th day. You can pick what day you rest on, but otherwise I want you doing your strengthening because it's a treatment. It's not a maintenance. So 2 to 3 times is what you're looking for to maintain health. Stretching is really important, especially if you've had radiation. Radiation pretty much stays in your body lifelong. So stretching is super, super important when it comes to those areas that have been radiated. If you don't, one of those days it's going to sneak up and you can't reach that shelf in the closet because the radiation from breast cancer or my head and neck patients, one day they realize they can't turn to drive. And 7 to 10 years after head and neck radiation, many patients, this is what they have. A very tiny bit of movement. So that's, I stress with them, stretching every day is super important. And again, my breast cancer patients, stretching is very, very important. We're not going to talk about this slide too detailed, but low intensity versus moderate intensity, there are things that we do on a daily basis count as exercise. So you're gardening. I love to garden. So that is a form of exercise. So find the things that you like to do and find a way to incorporate it as exercise. The next slide. So we have this scale. When you're in chemo or 3 to 6 months after chemo, we want your effort level to be what we would call fairly light. Some effort with a little bit of increased breathing. We don't want to overexert the body that's healing or that's fighting and killing cancer cells. So that little bit of lighter exercise, but it still falls into that. You should be able to hold a conversation while you're doing the exercise. When we get to that moderate, you can hold that conversation, but occasionally on the harder parts, it's a little bit harder to maintain it. That's when you're getting into that moderate form of exercise. What do I have to think about for precautions? We'll move to the next slide. So a couple things you want to think about. If you have bone metastasis, there are certain precautions you need to take with exercise. You want to reduce any risk of fracture. So sometimes weights are not the best thing to use. If you have bone metastasis, I really strongly encourage you to go see therapy so that they can teach you the guidelines specific to you and the things you're looking for and give you an exercise program that's appropriate for you. Another option that we'll talk about down the road is the Livestrong program. They only work with patients with cancer, so they understand those things. When you come to programs here at the Cancer Support Community, they understand those guidelines and they factor those in, but your average trainer may not know that information. With chemotherapy, if your blood values are too low, so when we get to our hemoglobin and our hematocrit, are really low, I think the hematocrit's like below 25 and your hemoglobin is below 8, we don't exercise. Because at that point, your body is carrying enough oxygen to sustain you and your ADLs. So walking, dressing, bathing, eating. More than that, we don't want to tax your system. If you have neuropathy, you need to be aware of what exercises are safest. So I don't necessarily want my person with neuropathy and bad balance going to a yoga class that they're going to do a lot of standing poses, because you might be at more risk for falling. If you have heart complications, especially with our breast cancer patients that have taken Herceptin, it's a very common side effect is to develop some heart issues after. So being aware of making sure that your heart is healthy before you start, especially cardiovascular exercise. If you're on hormonal-based treatments, whether it's hormone suppression, which is usually with your breast cancers, your ovarian cancers, your prostate cancers, your risk of osteoporosis is much higher. So you have to be aware of your bone health and choosing exercises that are best for bone health. And if you're having joint pain, when is it appropriate to let your oncologist know? Okay, so those are things we're thinking about. The same goes for with bone metastasis. You need to know what the symptoms of are that it's a problem. Especially my biggest red flag is pain that's really bad and especially at night, at rest. At rest bone pain at night is usually a red flag. That's definitely a time to talk to your doctor. It could be nothing, but it's better safe than sorry. If you've had surgery or radiation, if you have lymphedema, there are certain considerations you need to take, whether it's wearing a sleeve because you've had lymphedema or knowing that you might be at higher risk based on your specific characteristics of number of nodes removed, complications after surgery. Those are important things to take into consideration. If you have scar tissue or cording, and that scar tissue can be with many, many kinds of surgeries. I've had patients that have terrible flank pain because of a scar. So sometimes that can really limit things, and it's a super easy treatment often that we can teach you how to manage that scar. Decreased core strength. Sometimes getting back into exercise, if your abdominal muscles are really weak, you could cause other problems. So if you, for some reason, suspect that that may be an issue from surgery or just from deconditioning, that's a factor you need to take into account. So if you fall into any of these categories, it's very appropriate to ask your doctor to have a course of PT. There's many patients that I see for 2 weeks at twice a week just to get a program established. Then I know how they're responding. Then they drop down to 1 time a week. And then it's like once every 2 weeks for 1 or 2 visits. And then we're like, okay, we got this. You don't need me anymore. You understand what you need to know. You've been educated about this new body that you're living in now, and you can go forward. But you also know that you have a contact if something comes up. You may not have lymphedema now, but I've had a patient who fell down the stairs, fractured her shoulder. Now she has lymphedema. Okay. Oh, I know who I'm going to. So they've already got that relationship established. Our next slide. Exercise in survivorship. This is not no pain, no gain. You really need to listen to this body. This is a whole new body for you once you've had cancer treatment. So really listening to it, slow and steady is what we're looking for. You want to avoid that exhaustion. If you do an exercise and you're exhausted the rest of the day or the next day, that's your body saying you did too much. And that's why we go slow and steady, even if it's a healthy cancer survivor coming into me just to learn how to exercise. Not sending it home with you until I know it's okay, because I want to know what your body said. Somebody might come in and say, oh, that wasn't enough. I'm totally fine. All right, I'm going to kick it up a notch. They come back in the next time and they're like, oh yeah, that was too much. All right, we got a parameter now. We know what we're working with. So it is not no pain, no gain. If something hurts, you probably need to modify what you're doing. Next slide. Those psychosocial interventions. So it's not medicine, it's not physical activity. Um, Cognitive behavioral therapy, educational therapies, even the programs you come here today. This is a psychosocial intervention because you're learning about your body during cancer and after cancer. Mindfulness-based stress reduction. I know that they do a ton of that here, and that's usually where I refer my patients to for those types of things. Supportive expressive therapy, that's your traditional talk therapy. I tell my patients, nobody ever taught us how to have cancer. Nobody. And nobody in our life that anybody in our life that hasn't had cancer, they don't know what to say or do. Where getting those feelings out of your head and talking to somebody is an amazing treatment option. We get this dialogue in our head. I may not be a cancer survivor myself, but I have invisible disabilities, and I get those dialogues in my head. And sometimes you just need to spit them out and tell somebody, and they're like, "What are you talking about? That makes no sense. Why do you think that?" And they ask you questions, and you're like, "Yeah, that's kind of dumb. What was I thinking?" So we just need somebody to redirect that internal dialogue in our head. And dealing with that emotional component of our body and our health really can have an impact on that fatigue level. You see the commercials about depression. I'm so good. I'm so tired. Well, yeah, it has a big impact. People say, "Oh, it's all in your head." Well, yeah, it is because it's in my brain. It is part of your body. Okay. But it has a huge impact. It's the controller of your body in many ways. So we need to take care of all of our body, not just our muscles. Some of the expressive things I've many times you used to at least have a journaling program here or writing or something.
Poetry and then art
Okay,
classes.
so if I have patients that I know from some things they've done in the past or things they've said, I'm like, "Oh, have you seen this or have you seen that?" That would be a great place for you to go to talk to people that have experiences similar to yours and may be able to share with you something that helped to them. I don't often refer people to Facebook groups because they're not moderated and it can be unhealthy. But coming to places like the cancer support community where they're guided by professionals is a much healthier environment to get answers to questions and things like that. Some of those common mindfulness activities, walking, meditation. My brain doesn't slow down for meditation. I would love to take a meditation class because I would love to be able to figure that out. But yoga, breathing techniques, Tai Chi, Qigong, just overall meditation. Those are great options that have a direct impact on fatigue, and the research supports it. That's why they're placed into these treatment protocols and recommendations. Um, Psychosocial interventions also include sleep hygiene. I talk to my patients about sleep hygiene all the time. Try to teach my children good sleep hygiene. Try to teach my parents good sleep hygiene. It's a real challenge. One of the things we'll go through the healthy sleep and then we'll talk about some interventions. Both your mind and your body need that sleep to heal and recover. We really do most of the healing in our body during those stages of deep sleep. So if you wake frequently through the night, you're never entering that deep healing stage of sleep, which is really important. For adults, they recommend 7 to 9 hours of sleep. I find with my older patients, rarely do they ever get 7 to 9 hours of sleep, but getting that rest during times that you should be sleeping is also important. Good sleep includes falling asleep easily, staying asleep, and feeling rested when you wake. If you don't have those three components, then you may benefit from talking to someone about sleep because you really need that in your whole survivorship and in your cancer treatment. Our next slide, some healthy habits. One of the biggest things I tell my patients, your bed is for two things, sleeping, and I think y'all know what the second one is. So if you're not doing one of those two things, you shouldn't be in the bed, okay? So getting up, even if you're really tired and you don't have the energy to do something, get up, get dressed, and go into another room. If you need to come back to the bed to take that rest in the afternoon, that's okay. Typically, we try to encourage people to not nap for more than 45 minutes because then it starts to disrupt your normal sleep cycle and the rhythms that your body naturally has. Try to establish a strong bedtime and wake time. This is really hard for some people, and I really encourage them to slowly shift it to a more normal time. A lot of my patients will say, well, I can't get up until 12, 1, 2 o'clock. I'm like, how do you ever get a doctor's appointment? So then they get these doctor's appointments that are way out of their normal sleep cycle, where maybe we can work on that normal sleep cycle to make it fit your daily routine better with all these doctor's appointments. Limiting stimulating activities before bed and in bed, such as the TV, the phone, caffeine, nicotine, eating a lot of sugar, or even alcohol right before bed. A lot of my patients, like me, I actually read on a Kindle, but I have the lighting reversed so that it's a black background with white letters, so there's less light in my eyes to do that. And my brain knows when I take my medicine and I read my book, pretty soon I'm going to fall asleep, because just like our kids, we had a bed routine, right? All right, we're going to wash our face, wash our hands, brush our teeth. We're going to put our jammies on. We're going to read a book. We're going to have a snack. Okay, my body now knows it's time to go to bed. Your adult body does the same thing. So if you create a restful routine that your body can predict, you're more likely to fall asleep more consistently. I know that when I put my CPAP mask on, my brain's like, out, we're out, it's time to go to sleep. So I've kind of trained my body into that. Does it work all the time? No. When I'm really stressed, nothing works, just like everybody else in the world. But it's really helpful for the daily routine. Sleep space. I really struggled with this when I was, I have done hospital care at home many times because of my medical conditions, and on those high dose steroids, it was really hard to sleep, and I would need that afternoon rest. And the nurse was like, this is it. This is wrong. This whole room is wrong. We can't do this. And I'm like, okay. She's like, all right, blinds are closed, pull in the curtains. You need to decrease the temperature in here. It needs to be in the 60s or your body doesn't think it's time to go to sleep. And it really does make a difference. So creating that environment that's natural for our bodies. Avoiding the heavy meals and alcohol, we talked about that. 3 hours before bedtime. You want to avoid those kinds of things. Don't look at the clock in the middle of the night. One of the best tricks that I learned was if you know that you've been awake for more than a half hour, it's best to get up and do something. Get up, get your heart rate up, move around, distract your brain, and then like 20 to 30 minutes later, come back and lay down and you're more likely to fall asleep. I don't completely understand the science behind all of that, but it really does work. Consider journaling about your worries or having a notepad next to your bed that you can write them down, because if you've written them down, you know you'll remember and come back to it, so you don't have to think about it right now. So that's really helpful. One of the things that I really love, there's an app, and it's called Sleepy Time. It's a great app. The guy's voice, there's several people that read, but their voices are just so soothing, and they're stories that are enough engaging you want to listen to it. I don't think I've ever been awake at the end of one. So it's a really good technique for me when I can't quiet my mind to use that as a way of falling asleep. I just have to find my AirPod in the morning because it usually has fallen out and is in the sheet somewhere. Um, you want to maintain that balance between rest and activity. So when you have fatigue, we want to talk about energy conservation and activity pacing. Set your priorities. What is really essential? How many people have asked you during your cancer journey, what can I do to help? Really, do you need to be the one to clean the bathroom? Do you need to be the one to pick up the groceries or cook that meal when somebody's volunteering to help you? Accept that help from them. It makes them feel good too, and it helps you. It helps you decide what the most important thing for you is to give you joy, to help you in this journey. Pace yourself. If you notice that you're not able to talk during a task, maybe you're getting too fatigued and you need to sit down and take a rest. Delegate, ask for help. Use devices. A bedside commode next to the bed, especially in the night, can help with your sleep quality. It can help with your partner's sleep quality because they may not have to get up to go to the bathroom with you. So I find so many people are resistive to these types of things. But if it makes your life easier and others, who cares? They're there for you. It's not permanent, most likely. A rollator. I love a rollator for my cancer fatigue. It gives you the ability to be out and do whatever you want, but you always have a place to sit down and take a rest. Anytime you need it, you can sit down and take a rest. If it gets you into the community, that's what's important because engaging with people is what's going to make your fatigue better in most people's cases. Schedule activities that you have your best energy. Some people don't drive well at night. Well, if you know you're really tired at night, don't schedule activities at night. Don't schedule them in the morning if you know it takes you a while to get moving. Schedule a rest time after activities. I always tell my patients, if you have a big event, a family birthday party, a wedding, plan so that you don't have anything on the schedule the day before or the day after, and expect you're going to be tired. Because if you're not, then great, you can just go do stuff, but you've planned it into your schedule. And engage in activities that distract you from fatigue. Even if your body's physically tired, try and do something with your mind. Sitting and watching TV is not engaging your mind or your body. So whether it's playing a game or reading a book or sitting and paying bills, sitting and chopping vegetables, find ways to conserve your energy, but still be active. One of the things I often tell my patients when we're just getting back to activity is commercial cleaning. I'm notorious for this when I get sick and I'm recovering. Okay, it's a commercial. I'm going to get up and I'm going to go wipe the counter. And then when the commercial's over, I probably need a rest. Or I'll stand when I fold my laundry because it's going to give me 5 or 10 minutes of standing, which is fatiguing enough in and of itself. Bring a stool into the kitchen to do meal prep. I know oftentimes when I'm recovering, my kids are home and they're cooking and I sit and I supervise and I direct. I can't do it, but I can tell you what to do. And it's a good way to spend time with them. But finding creative ways and different ways to do things that bring you joy. Rehab services. So Christiana Care, we're the only oncology therapist that I know about in Delaware. They've been trying to start a program at the hospital in Milford. I don't know what the status of that is, but at least in like the North Wilmington area, I know we're the only ones that have a program. We have services available at the Concord office, which is just over the state line on 202. We're trying to expand to other locations, but it's really hard to find oncology therapists. You know, it's like starting all over. I became an oncology therapist because I was told I couldn't practice because I couldn't be around sick people anymore. Well, my cancer patients can't be around sick people either. So we make a really good match for each other, but it was like starting all over. And some people say, you know, I don't want to be around kids that are sick. I don't want to be around cancer patients. It's sad. It's not sad to me. I did something to make their lives different, hopefully a little bit better. So when to think about getting involved with therapy, If your balance is impaired, we talked about some of those precautions. That's a great time. We are here to help you function and be safe. Um, I often tell patients the doctors are there to save your life. I'm here to help you live in the body that you're left with, because we all know that body is not the same as before the cancer diagnosis. It's just different. And we just might need to modify the way things are. And we have to learn to give ourselves grace. It's okay to be this way. And I think that, having my medical issues has helped me be more empathetic with those kinds of things. And many of us in our practice actually have that experience. What adaptive equipment or footwear or orthotics might help you? How can we educate you on pain management strategies or adaptive techniques to do the things that you want to do? Sensory education and desensitization for those of you that were at the neuropathy talk. That's a really big component of what we do. Promoting that return to safe exercise. Do I have lymphedema? How do I manage that? That's a lifelong thing you need to know about. All of our patients that have had lymph node involvement, we educate them on lymphedema precautions, because even if you don't have it now, you might have it later. And we need to teach you how to live in that body. So those are some considerations to think about. If you've had a recent fall, your fatigue is interfering with your everyday activities. You're stumbling, tripping, reaching out to hold on to furniture. Those are times you need to have therapy. Dizziness with positional changes. That neuropathy affects the ears too. Many people had dizziness problems before treatment, and now they're even worse. I do often refer to some of our vestibular therapists. My brain's just getting too old to learn that many new things, and they're the experts. So I do refer to those therapists also. When pain is interfering with your mobility or daily activities, what can we do to manage that pain? What can we do to make the pain less? What modifications to your activities or additions of equipment can help with that? Those are all reasons to look at therapy as an intervention. So some of those, we saw this slide in the beginning. There's a whole group of people when you're in a cancer center, and it's not just Christiana's Cancer Center. We have many patients in this community that go to Fox Chase, that go to Penn. They all have these programs. If you've got anemia, your doctor and your nurse navigators, I believe most of the programs have a nurse navigator. They're the person that you can go to with a question, and they're going to guide you to the right professional to manage that question. And they have so much knowledge and experience. Oftentimes they can answer your questions. If you have muscle aches and pains or weakness, that's when rehab's coming in. The side effects of your medications, those navigators know strategies to manage those different things, like the nausea, trying not to have hot foods because the smells are stronger, or putting a lid on something to kind of quiet the smell when you drink it. Our nutritionists are great with that kind of stuff. Pain management, palliative care, your rehab services, they're all strategies that you can implement to help with pain. Your comorbidities, that's where your nurse navigator is going to come in. Your primary care. If your other medical conditions aren't being managed because you're so overwhelmed by your cancer treatment, that's going to contribute. You may have to find that energy in that way to get that under control so you feel better. I know we're all overwhelmed by all the appointments, and I get that. But sometimes that little bit of effort is going to give a huge return. Nutritional deficits. The nutrition services at the cancer centers are amazing because those are the only patients they work with. My mother-in-law has pancreatic cancer. Before we even started, we went in and talked with her so that we had the supplies we needed to be ready. In our experience, we had all the supplies for all the side effects, from diapers to nausea meds to wipes. We never needed any of them. So our philosophy is, if we get it, we probably won't need it. It's worked pretty good for us so far. I've got a whole durable medical equipment in my sunroom at my house because we brought it all with her from her home from when my father-in-law had it. We haven't needed, I used it. I used it when I had surgery. She hasn't needed it yet. So our theory is working pretty good so far. Emotional distress, just dealing with the diagnosis, dealing with the pain, dealing with the doctor's appointments, dealing with how people look at us different now. Our psychologists and behavioral health are amazing resources. At our cancer center, they only work with patients that are actively in treatment, but they also have referral lists for the community. Sleep disturbances, our behavioral health and our sleep doctors have great recommendations and can work with you for those types of things. So we talked about pretty much all of those things. We have smoking cessation programs at almost every cancer center. There are home care services. I do get patients that come to me in the outpatient setting. And if from my conversations with them, I don't feel like they're safe at home, that I may say, you know what, now's not the time. I need you to do home therapy and make sure you're safe there. Have them make modifications, teach you how to assist your family member, and then come see me. So home care is very appropriate at some times. The Safe Steps program is a fall prevention program they have at ChristianaCare. It's pretty common in many centers now. So a couple of the things that I really liked, we talked about the NCCN for their resources related to every type of cancer, various side effects. They have patient-friendly information you can get. The National Center for Complementary and Integrative Health is another great website. So you all hear on the TV, oh, take this supplement for neuropathy. Oh, take it, do acupuncture. It helps this or it helps that. Well, if you go to that website, it gives you the research and tells you, is it weak? Is it moderate? Is it strong? I'm going to tell you, for any complementary health, none of them are going to say strong support. But I can say that there is moderate support for exercise, meditation, yoga, acupuncture for appetite, pain, and a couple of other things. It's been real, the research has really supported it, and that's a great place to look. And there, number 2, Cancer Support Community at Delaware. I refer to them all the time. UD Health Coaching, I believe they're getting that back up and running because it's in conjunction with the Cancer Support Community. The Live Strong program at the Y. I find that if you're going to do an exercise program, if you do it at a community level, you're more likely to continue because you want to know what happened with the conversation that you had with Susie last week. Or if you don't show up, Sally's gonna be like, why weren't you here? You know, you really have a little bit of that accountability incorporated in it. And I also feel like at the Cancer Support Community here, you get to know people and you want to come back. It's not like, oh, it's 44 degrees out and it's windy, I don't want to go outside. That is not as a burden as it is, I really want to go see so-and-so and see what happened. The Choose My Plate is the dietary guidelines to help give you some nutritional information. Cancer Round I had on here, it still exists, but I think you have to pay for it now. It used to be free for some patients, like at ChristianaCare, but I still really like it. It's almost like a Cancer Support Facebook. You have like a feed where you might post things. It has questions to ask when you go to your doctor's appointment, when you go to the surgeon, how to prepare for your first, chemo session. It also says, there's this one, we talked about that internal dialogue, and it'll say, let me say, for example, I feel like a burden to my family. It's got a sheet on there that asks you questions to help redirect that thought into a healthier thought and a more positive thought to help you realize, no, I'm not a burden. But we all put that in our head when we're depending on others. So it's a great resource to kind of redirect that internal dialogue. That's one of the things I like the best about that particular website. And there's just some of the resources that we used when creating this presentation. I'm happy to take any questions. I know there's not a lot of us, but I'll answer any question I can for you.
I have one. Sorry. I liked when you were going over the sleep, health, right? I remember, like, for me, I would get up, like you said, I would just kind of stay in bed and hope for the best that I would go back to sleep within an hour or so. And then I was talking with someone and you just like confirmed it for me, not to stay in bed. Like you said, just have bed for sleep and the other thing. And so, I started to do that and it really did help me. The other thing that really helped me was like your worry thoughts, because I'm an overthinker and that would be the time when like I could cure cancer. I mean, just overthinking everything. So, I just established like 6:30 every 6:30 p.m. I get my like journal thing out and I write all my worry thoughts down. Everything that's like on my mind heavy at 6:30, and it's almost like I envision like putting all of those thoughts like on a leaf that goes down the stream. And it's like it's on the paper and it's off my mind. So I know in my head that it's on that paper and it's going to stay there because I'm going to go to sleep.
I love that analogy with the leaf, though. I really do.
Yeah.
Yeah. So I just wanted to like share that, and grateful for joining this evening, because a lot of what you said and even the support, like the last class that they had, I learned about nurse navigators, and you guys, you know, went like right ahead and had a nurse navigator call me, and because I was getting overwhelmed with all of the doctor visits and the surgeries that I was having, and like it went crazy. And so this person called me and it was the best conversation for me, and it was like she helped me figure out, like a lot of what was going on with me. So I'm really super grateful for these sessions. So thank you.
I really feel like our practice is very holistic. It may
Mhm.
not be the thing the average PT is going to do or the average OT is going to do, but it's what my patient needs to succeed and move to the next step. So it's worth the effort to do it because I'm taking care of all of you. I'm not just taking care of your right shoulder. I think that's a really big difference when it comes to this type of an oncology practice. And I'm sure that they have those things at other places too, I would hope. But we find it very important to take care of the whole person. There are times that I feel like more of my session is a psychology session than anything, but that's what they needed that day. And there's also times where I've said to a patient, your mental health is so poor right now, no matter what I do, I'm not going to make your pain better because it's having such an impact on your body right now. We really need to address this. And it's made such a difference in some cases that you'd be surprised how much of an impact it has on our bodies.
Yeah. I have a question if you're done. Does I have had chemo, 3 different kinds of chemos, because I became extremely sick and lost about 30 pounds. Now I'm much better. But I had chemo and then I had surgery and then radiation and then chemo again. But my eyes are the problem. I have really difficulty seeing things, and reading is very difficult. I have seen 2 ophthalmologists, and I also see a retina specialist. But I have a question. In other people's experience, do they see this, or it may be age related, or that's the question.
No, I've noticed a big change in my vision since I completed chemo, and also in progression of cataracts, that my eye doctor tells me he feels it's directly related to the chemo.
Okay. Does it get better at any time, 6 months, 1 year? Is there any
It
chance?
hasn't for me. I'm not, it may for other people, but it has not for me.
But
I'm to
30
the point now where I'm not driving at night because I don't feel confident in my ability to see well enough to navigate at night.
Okay. I
Yeah.
understand. But in some cases, you think they got better?
That I don't know. I'm not an eye doctor.
Sure, of course, of course.
And we lost the screen. I don't have a lot of experience with that either, so I don't really, I'm sad that I can't answer that for you.
Okay, that's fine. That's fine. I should check GPT, I guess.
Hey, it's worth a
These
shot.
days, these days I just do that. Thank you. Thank you.
I have a question, and this is sort of a big theoretical question, but I've been struggling with it. I am now 5 years out from treatment, and I struggle with the issue of, is my fatigue ongoing due to the treatment that I received, or is it related to aging, or is it a combination? And every time I try and bring this up with a healthcare provider, I kind of get blown off in the sense of, what difference does it make? But obviously, if I'm asking the question on a workshop, it makes a difference to me. Is it totally abnormal to still, no, it's not to the degree that I had, but to still feel the fatigue and as though I need to pace myself 5 years
It
after
is not.
finishing treatment?
It is not at all. We talked about the statistics. I think it was, I'm a terrible numbers person, like 20 to 30% have
Right.
that lifelong residual fatigue. I think that we often don't have as much energy as we get older. Are you on a regular exercise program?
I am.
Okay.
I am, and it's not debilitating. It's nowhere near the extreme that it was, but it's more my stamina. I just haven't, and I'm starting to kind of come to an acceptance that I'm never going to have the stamina I had when I was 50. So
Well,
trying to
Even
work
if you
with
didn't have cancer, that would be the case.
right. Well, I guess that's pretty much what I was saying. I guess the people who are telling me it doesn't matter what's causing it are probably right to stop perseverating over it and just
Well,
what I'm doing to deal with it.
I find that healthcare providers want to address the things that they know they can fix. That
Oh, yeah.
you're not going to die of fatigue, so they're not too worried about it, and it's not really in their purview.
Right.
But it is one of those pieces that I find that you have to give yourself that grace. It's okay. I fought cancer and I'm here and I survived. I just might have to do things a little bit different
Yeah.
and prioritize. Nobody cares
yeah.
if your floors are scrubbed, but if you go out to ice cream with your granddaughter, that's way more important.
Yeah. Yep. And I also wanted to throw out really quickly, if we have a second, another resource. You mentioned the health coaching through UD. UD also has an exercise counseling clinic that they do on the STAR campus with their physiologists.
Is there
So-
a phone number for
You
it?
have to have a certain diagnosis, correct? You have
There's
to
a
have
whole
a medical diagnosis.
There's a whole list of diagnoses, and
Okay.
somebody trying to recover from cancer treatment is one of the conditions that they will at least evaluate you for.
Is there a cost for that program?
They have 2 different programs, and one of them is free, but you need the evaluation to see if you qualify. My impression, because I've had conversations with them, is it's not a financial thing that qualifies you. It's
Exactly.
like your health condition. Yeah.
Can I ask
Thank you
you
for
something?
reminding me. I haven't referred patients to that for a while.
Can
Yeah.
you
I'll-
give
I'll
the
put the
phone
phone number
number
in
for
the
those
chat.
2 places?
Yeah, I'm gonna put it in the chat.
Okay, great.
831.
And when we send the recording, I can add that to the resource list too.
Oh,
Thank
thank you,
you.
Erica.
Thank you.
I have a question.
Go ahead, Laura.
Okay, you mentioned that waking up, no matter how much rest you get, you don't feel great. So pre-cancer treatment, if I slept through the night and I got enough sleep, I felt really wonderful. I do not get any of that any longer. So I'm just wondering if you have an idea. I guess it's probably different for everybody, like how long that might
Well,
last.
as a healthcare provider, one of my very first thoughts would be, have you ever had a sleep study?
I have not.
Because when patients wake up not rested, there could be sleep issues going on that maybe you didn't have before.
Oh,
And one of the things with my fatigue patients, I always look to see, do you have obstructive sleep apnea? Do you snore? Do you wake up choking in the middle of the night? Because those are definitely factors that would indicate potential for sleep apnea. And even just speaking to a sleep specialist would be the person I would talk to, because it should have gotten better over time, but it could be a totally different, something that happened coincidentally at the same time, or it could be a direct result of cancer treatment. We don't really always know.
okay. And one other quick question. You said that having bone pain at night, even at rest, is a red flag. So I'm on tamoxifen now, and I'm having a lot more bone and joint pain. I was just
So is
trying.
that since you started the tamoxifen?
Yeah.
Okay, so tamoxifen is notorious for causing bone pain. It would be something that I would encourage you to talk to your oncologist about. And I'm not recommending anything by any means, but I've had patients that have done a vacation from the tamoxifen for X amount of time to see if their symptoms resolved, because then they knew for sure that it was related to that. I've had patients that have switched from tamoxifen to another version. I think it's called letrozole, but I'm not positive. And then sometimes once they transition from tamoxifen to anastrozole, which I believe anastrozole is once you've confirmed gone into menopause, that they switch you to that. Again, I'm not a doctor, so I don't completely understand the meds, but it is notorious for bone pain. And I've also had some patients that have had very frank conversations with their doctors about, okay, what is my risk of reoccurrence with taking tamoxifen and not taking tamoxifen? And based on their specific type of cancer and all of the various little categories they categorize it in, I've had a patient make the choice that the risk benefit was better for her to choose not to take it. And that's a very individual choice. But if someone told me it reduces my risk of recurrence by 3%, but it made me feel like absolute crap all the time, I might make that choice. And I've never had a patient, that's the only patient that's ever come to me and said that. And I think it's brilliant. It's a very valid conversation, because in my opinion, quality of life is so much more important after you've had cancer. You really pay attention to it. So it's a conversation to be had with your doctor, but it's a very common side effect. And I wouldn't go right to metastasis in that type of situation. And usually it's probably what you're having is today it's in my shoulder, tomorrow it's in my knee.
Yes.
Sometimes it's everywhere. Where if it's every night in my shoulder, then I'm more concerned, because certain kind of cancers go to certain places. And when they tell me one of those places, that's when I think red flag.
Oh, okay. All right.
So
Thank you.
like when it bone cancer, when it metastasizes to the bones, the spine is very common, the shoulders and the hips. Those are the big places that when it's causing pain, that's where it's at.
Okay. This has been really helpful. Thank you so much.
I have a
Absolutely, I
suggestion.
love doing it.
Sure. I have a suggestion for Nina. I'm a physician, I shouldn't say that, but what my experience is that if there is forever kind of fatigue, this long period of time, you should get some of the tests. I had a patient, she was almost like you. 3 years later, after her cancer, she had a lot of problem with fatigue. So I did her B12, B6. I don't know if you have had those. And also zinc. One patient had zinc deficiency, and after she started taking zinc, her fatigue went away.
Yeah.
And
As I
vitamin
said,
D.
it's not overwhelming. It is not debilitating. I just
Those
noticed
are
that.
those are very simple tests and
Yeah.
simple solutions.
Yeah.
So I thank you for pointing that out, because it has become routine for me to ask my neuropathy patients to ask for a vitamin D test now. But I didn't think about it for my fatigue patients. So thinking about those levels could really be an easy solution. Might not work, but it's only a blood test.
Sure,
Thank you.
you're welcome.
Thanks for having me, guys.
All right,
Thank
thanks
you.
for joining us. and have a
Thank you.
good
It
night.
was wonderful. It was very nice.
Yes.
Oh, well, real quick. She'll send these, you can scan these and attach them, right?
Yes.
There's 2 handouts. The one talks about the symptom and what type of exercise is best for that symptom. I can't read it because I don't have my glasses. But the other one, I really like this sheet. When the doctor says, do you have fatigue? Rate it 0 to 10. What does that mean?
Yeah.
This actually categorizes it from I'm too tired to eat, I can't get dressed, to I can do my household tasks, but I can't go out into the community and do things. I can't do my work related. And this is what I use in my practice, because if you're going to give me a number, I want to make sure that's really the number you are. And I have very specific questions so that I can tell when it's getting better. And if you see yourself on this sheet, then it helps you give a more subjective number to what you're, a more objective number to what you're feeling. And if you're at a 4, you need intervention. So intervention could include looking at your medical status, from blood work to other health conditions to getting an exercise program. Something needs to be done if you're at a 4 or greater.